Hi, my name is Richard and welcome to the Colorectal Cancer Prehabilitation class. We know that prehabilitation is really important to help people prepare for their treatment, and physical activity is one really important component of prehabilitation. We know from research that by undertaking a period of physical activity prior to treatment can lead to fewer complications with your treatment. It can lead to fewer days spent in hospital, and we also know that it can help improve outcomes potentially, and it's also very good for helping improve quality of life, maybe reducing anxiety during this really quite difficult time. So we've put together an exercise class which we'll also be doing face-to-face. And this class here today is really designed just to introduce you to the sorts of exercises that we'll be doing. So we're going to start with a warm-up, we're going to continue with a little circuit class, and then there'll be a nice sort of cool down afterwards and some breathing exercises to help relax the body and relax the mind. And the aim of this class is really to get you sort of, really start to improve your aerobic conditioning, so your heart and lungs, and increase your muscle strength to again prepare yourself for your treatment. Safety is a really, really important thing. It's my number one priority here. So what we need to make sure is that we've got a nice, clear space for doing your exercise, that we've got good ventilation, and it's always good to have a bottle of water. Wear some nice loose clothes, some soft shoes, and if you're feeling unwell at all, or you've got any injuries, or if your doctor said not to exercise, then please don't do this class. Okay, wait until you've got the go-ahead from the doctor, or when you're starting to feel, when you're starting to feel better. If at any time during the activity you start to feel really, really breathless, slightly dizzy or faint, or having chest pain, then please make sure that you stop. We don't want you to carry on in that case at all. The most important thing, of course, though, is to smile and enjoy this class. We're going to hand over now to Zoe, who's going to take us through our warm-up.
Hi, my name is Zoe and I'm going to take you through your warm-up. Now Richard here is going to do the seated versions. So if you do struggle with your mobility at all, or you're a little bit unsteady on your legs, then go for the seated version. Are you ready, Richard?
I certainly am.
Okay, so standing with my feet and knees hip width apart, Richard's going to be sitting nicely on the chair. If you do have lower back issues, maybe pop a cushion behind the lower back. And we're going to start with the shoulders. Are we ready? Up to the ears and big circle round. So do me some nice big circles through the shoulders. Think about standing nice and tall for me, or sitting nice and tall through that spine, so no slumping. And let's make that a little bit bigger. Bring your fingers to your shoulders and let's circle those elbows. So if you've got your shoulder issues, maybe make your circles a little bit smaller. I don't want this to be uncomfortable or painful in any way. Relax those arms down. Let's go with your right hand now. We're going to do a big circle with that right arm. But again, if that's uncomfortable with your shoulder, make your circle a little bit smaller. Last one, and rest. Now with your left, all the way up, big circle. Good. I'll be smiling, keep going. Nice big circle, lovely. Last one for me. Now with the shoulders up to the ears, we're going to shrug and down. Shrug and down. Just warming up the shoulder girdle. One more. And rest. Okay, be cautious if you have any neck issues, but I would just like to warm up the neck. So to the right, look to the shoulder and back. To the left, shoulder and back. And again, shoulder and back. Last one, shoulder and back. Okay, let's start with a little march. Are you ready, Richard? So march you on the spot. So think about using the arms as well. Think about a nice tall spine, and if you can, think about just drawing your belly button also to your spine so your core muscles are working nicely. Good. Now keep marching. We're going to do a little bit of coordination here with the arms. We're going to go forwards and back. And again, forwards and back. Good. Keep it going. And forwards and back. Lovely. And forwards. Now let's go up into the sky, and up, and down. Now if this march is too fast, go slower, and up, and down, and up. Now keep marching, drop the arms down, bicep curl, and drop. And again, lift, and drop. Brilliant, keep it going, lift, and drop, and lift, and rest. Now heel dig, right foot, dig, and back, left foot, dig. So if you struggle with your balance here, you might want to move to the chair, okay? So just be cautious. Dig, and back, dig. Now we're going to do a little bit of brain training at the same time. Opposite arm, opposite leg. Forwards and down. Forwards and down. Good. Keep it going. And dig. And dig. Two more. Dig. And rest. Lovely. Okay, let's bring our hands together. Bring your hands together. We're going to do some nice twists through the trunk to warm up the waist. So to the right, we're going to twist and centre. To the left. Twist and centre. Lovely. Twist and centre. Good. Come to centre and rest. Now, if your shoulders are okay, lift the elbows up. If not, leave the elbows down. Let's go again. Twist and centre. Now, try to keep your hips facing forwards for me, if you can. So we're not twisting through the knees. We're only twisting through the waist. Two more for me. And twist. Good. And twist. And rest. Rest those arms down. Let's have a little circle through those wrists, because we may be using some elastics in your circuit, so it's good to warm the wrists up. Lovely, relax those down. Let's go with the right leg. Now, if balance is a problem, come into your chair. Let's circle the ankle. Or you can place your hand against the wall to give you a bit more stability if you prefer. Good. Let's go the other way. Get the brain going. And bring that in. Let's do the other leg. So take the leg out and circle. Now, if you are standing, make sure your supporting knee is slightly soft. Good, and maybe keep the core engaged. That will help you balance. Let's go the other way. Lovely. Good, and bring that down. Okay, I think we're ready to go for our circuit. Well done.
Okay, so now Zoe has warmed us up nicely, we're going to start with our main circuit. Now we're going to show you a series of the exercises that we'll use in this circuit. We're going to do a few repetitions, but suggest you maybe do 30 seconds or so, or maybe even up to a minute of each of these exercises. So we're going to start with the first two. The first one is a biceps curl, and the second one is a side leg raise. So we're going to start with the biceps curl, and we're going to take the band, okay, and we're going to step into the band, feet about shoulder width apart, okay, knees nice and soft, okay, belly button sort of towards the spine, so pelvis sort of neutral, and then we're going to bend at the elbows and raise the arms. Making sure that we breathe out as we come up and breathe in as we lower. If you want to make this a little bit harder, you can wrap the band around your hands once more. It just gives a bit more resistance, so a shorter band is more resistance. Okay? And if it's a little bit too challenging like that, we can just basically lengthen the band with less resistance, and we continue our bicep curls. Last one. There we go. Okay, so now we're going to do the side leg raises. Okay, so with the side leg raise, we're going to start with our right leg. Okay, and what we're going to do is just going to extend it out to the side, making sure our left leg, okay, left knee is nice and soft. Okay. So all the time, remember, the soft knees there, that's good. Okay, and then the last one. And if you want and need some additional support from the wall, helping balance, okay, basically get to the wall there, and we're going to start with our left leg this time, and the same process. Making sure you get your knees are nice and soft, and bring it out. And the great thing is the wall gives you a bit more support. So last one, okay, and if you want to make this a bit more challenging, we can use the band, okay, so again, step into the band. Okay, and then we'll pull the band up just to about hip width apart or so. Okay, and then exactly the same process, but the band is giving us a bit of resistance. Okay, and we're going to do one more. And that's great. So well done everyone, that's really good for our first 2 exercises. What we're going to do now then is we're going to get into our next 2 exercises, which are standing trunk twist, okay? And we're also going to do some sort of cardio sort of workout, which is a little bit of marching with some steps, okay?
Okay, so now we're going to go for our trunk twist exercise and our knee taps. So with trunk twist, we are trying to twist the trunk. So we want to try to keep our hips nice and stable, if we can, with our hips facing forwards. Rich is going to do the seated version, so if you're not quite so stable on your legs, then go for the seated version. So let's start with our hands up, so fingertips touching, elbows out to the side. Think a little bit of engagement in the core. We're going to go around to the right first, hips facing forwards and twist, and centre. Then to the left, twist and centre. Now you can either follow with the head, or if you find that makes you a little bit dizzy, you can keep the head forwards and still twist, but keep looking forwards. Lovely, 2 more of these, and then we're just going to make it a little bit harder. Good, so centre. Now take your arms out, nice and long. Draw your shoulder blades into the back. Again, fix your hips forwards. Let's go to the right, and twist, and centre. So you'll find it's a little bit more challenging on the core, keeping those hips facing forwards. Make sure those knees aren't rotating. Good, 2 more for me. Twist and twist. Good, now relax those arms down. Now we can make it a little bit more challenging by using your band. So if you pick up your band and have a go with your band. So I'm going to place the band underneath my feet. I'm going to grip the band from the outside, and then I'm going to pull the band up. Now we can come in front of my tummy, which is a little bit easier, or I can come in front of my chest, which is also now working my shoulders as well. My knees are soft, my hips are fixed, to the right, twist, and centre. So you're working your upper arms, your upper back, and also your waist and your core. Good, twist, 2 more for me. And we're aiming to do 30 to 60 seconds, depending on your ability, and relax that down. That's quite hard with the band, isn't it? That's quite hard. Okay, so that's your trunk twist. Now we're going to go for a little bit more of a cardiovascular exercise, and we're going to go for a knee tap. So start with the right leg, and we're just going to bring that knee up, tap with the opposite hand and down, up and down. So we're stepping. So now if you find it's quite tricky to bring the knee up, you can go low, or you can go with Richard's seated version, or you can come a little higher with the knees, which you can also do when you're seated. Now if your coordination is a bit tricky, then go same hand, same knee. Okay? You also find if you do opposite hand and knee, it means that you might twist through the body a little bit. So same hand, same knee. Okay, let's keep it going. We're aiming here to increase the body temperature. Okay, you might get slightly out of breath. We don't want you really out of breath. Okay, so if you need to rest, and again 30 to 60 seconds of this exercise. Now I'm going to make it quite a bit harder. Just rest for a second. I'm going to bring the arms up and over. Up and over to the right, lift the knee. Up and over, lift the knee. Up and over, lift the knee. Let's pick up the pace and lift. And lift. Good. So if this is too hard, stay with your tap with your palm against the knee, okay? Good. And 3, 2, 1, and rest. Good. Well done. So next we're moving on to our upright row and also our body weight squats.
Okay, well done everyone so far. Our next exercise is going to be an upright row. Okay, so with this one, we get our therapy bands and we'll step into them. Okay, and the difference is here is we're going to cross them over. Okay, so just cross them over. Okay, we'll feet back, shoulder width apart, and we're going to just very slightly soft knees, and we're just going to bend at the hips there. Okay, keeping the back nice and straight, and then what we're going to do is we're going to draw our elbows up, and we're squeezing the shoulder blades there as if we've got a kind of pen between the shoulders. We don't want to let that go. and then down. Up, and then down. Making sure, of course, we're breathing out when we come up, and then breathing in when we come down. Keeping those knees nice and soft, okay, and keeping that back in neutral. We'll just do one more of these. Well done. Okay, and then our next exercise that we're going to do here is a body weight squat, okay? Zoe's going to do the version where you get a little bit more support by holding onto the chair, okay? So with our body weight squat, again, feet about hip, shoulder width apart or so, and then we're going to just literally bend and squat down, bum out at the back there, okay? And then coming up, driving up through the hips to the heels. So just squeeze the glutes, the bum, and down. So squeezing the buttocks as we come up and down. Squeezing the buttocks and we come down. Okay, how are you feeling, Zoe?
It's good.
Good?
It's good.
One more of these then. Or two more.
Okay, well done everybody, you're doing so well. So our last two exercises we're going to do are our side lowers, again for our waist, and we're going to do another cardio exercise which is called cardio step outs. So with our side lowers, we'll do it first without the elastic because it's a little easier, and Richard will show you the seated version. Feet and knees about hip width apart for me. Make sure you're nice and tall for the spine, nice and neutral for the pelvis, a little bit of engagement with the core, because as you pull up, I want you to use your core muscles and not really your back muscles. Knees slightly soft, hands to the side. Now imagine your body is between two panes of glass. So we want to stay on the side, we don't want to fall forwards. Let's go to the right first. Slide down to the side. Now squeeze the core as we come up. Let's go to the left. Down to the side. Squeeze through the core, make sure you breathe. Good. And squeeze. And again. And squeeze. Two more for me. Side and squeeze. And side and squeeze. Good. Rest it there. So I'm going to show you a slightly harder version. Now for Richard, using the band doesn't work so well with the slightly harder version, but what you can do is that you can have maybe a can of beans in your hand or a bottle of water, or if you have some light hand weights at home, you can also do those. So with the band, I'm going to place the elastic underneath my feet here, and again, the shorter the band is between your hand and your foot, the more resistance you're placing on here. Shoulder blades into back, knees soft, brace the core. Let's go again to the right. And you see the left side of my band stretches to my side, then I come back to centre. And this adds a little bit of resistance to the exercise. Make sure the shoulders stay down into the back, they don't come up around your ears. That's good. One more to the left. Lovely. And relax that off. Good, well done. Okay, let's move on to our cardio step out. So you're going to need your band there, Richard. So with this one, I'm going to be stepping out to the side and stepping in, and Richard's going to do a slightly different version where he's kicking the leg out. If you're kicking the leg out though, don't fully extend the leg, keep a little bit of softness in the knees. So let's hold our band around about shoulder width apart. If this is too difficult, go a little bit wider. Knees are slightly soft. I'm going to go to the right first, right leg for you on your kick out, Richard. When you're ready, we're going to extend our band, and out and in, out and in. So Richard's kicking his leg out as he stretches his band. I'm stepping out to the side and stepping in. Soft knees. Maybe a little squat there, not too deep though. And we're going to keep that going. Out and in, and out and in. Good. A few more. Now if this gets a bit too tiring for your upper body, we can go without the band. So out and in, out and in, out and in. Good. Two more. Last one. And rest. Well done.
Okay, well done everyone. You've finished the circuits. Now what we're going to go on to is our cool down and some stretches. So the idea of this is just to basically bring our heart rate, bring our breathing rate down, ready for them to do some stretches to help with our flexibility. So we're back basically to the beginning of this video, which is where we started doing our warm-ups, and this is essentially, it's the reverse of the warm-up. So we're back to our marching. So I step in there, and as Zoe's showing, we can do this seated as well. And we'll have some shoulder rolls, just back. That's good. And forwards. That's good. Okay, we can just let our shoulders relax. And we bring ourselves nice and slowly down. Okay, bringing that intensity down, and we can come to a standstill. Okay, and now we can go into some stretches. And the first of these stretches we'll do is a shoulder stretch. So we're going to bring our right arm over to our left shoulder, and we're just going to give ourselves a little tap on the back, say well done. With the other arm, the other hand, just grasp just above the elbow, and then we're going to just pull it across, and you'll feel the stretch, the back of the shoulder. Remember to breathe, and as you breathe out, just deepen the stretch. We don't want to go too far, just get to the point of sort of mild tension. And then repeat from the other side. Okay. And same again. Well, ideally, we want to hold the stretch for about 15 to 30 seconds. Remember to breathe, and as we breathe out, just deepen that stretch. Okay, that's good, well done. Next one is the tree hugger. Okay, it's going to help stretch our back out. So we want to grasp a tree trunk. Okay, head down. Okay, eyes to the floor. And we want to squeeze, just really squeeze and hug that tree, feeling the stretch across the upper back. Remembering to breathe. That's good. So again, 15 to 30 seconds for these. And as we come up, we're going to do a chest stretch. So arms up as if we're being frisked. Okay, and then we just want to draw our shoulder blades back, elbows back. Just imagine we're trying to squeeze a pen in between those shoulder blades. And we'll feel that nice stretch across the chest there. Again, same thing, about 15 to 30 seconds. Breathing out as we deepen the stretch. Okay, that's great, well done. We're now just going to do some mobility for our ankles. Okay, so we can basically just start to roll our ankle around. If you need some more stability for this one, just put your hand against the wall, okay? And then we'll go the other direction. And then other side. And then the other direction. And then finally, okay, we're just going to get some mobility in our wrists because we have been using those therapy bands a fair bit today. So we're just going to do some wrist circles. Okay. Just to get that mobility in our wrists. And the other direction. And relax. Okay, well done. The last thing we're going to do is some abdominal breathing. This is going to really help relax you, okay? And this is something that can be done any time, not just at the end of the workout. And the idea is we breathe in using our abdominal muscles, okay? So we should feel our belly rise as we breathe in. And we're going to breathe in for a count of about 3 seconds, and then we're going to breathe out for a count of 4 seconds, okay? So the out breath is always longer than the in breath. You might find it easier just to have your hand on your belly so you can actually feel your belly rising as you breathe in for 3. And out for 4. In for 3 and feeling that belly rise, and out for 4. If you're sitting down, you can close your eyes, you'll find this more relaxing. You can even lie down and do this one. So in through the nose, out through the mouth. Last one. And That's great. Well done, everyone. Remember, you can use this anytime. It's a very nice way of relaxing the body there.
So well done for your exercise circuit. I really hope you enjoyed those exercises. I just wanted to finish with some exercises working on your core and also on your pelvic floor. These are great exercises in preparation for treatment, especially for surgery and certainly for abdominal surgery. You can do these prior to your treatment, and with support from your physio, you can also do those after treatment as well. But also check after you've had your surgery. We're going to start with some abdominal work, and I'm going to teach you how to properly engage those core muscles. So if you think about the core, you've got your diaphragm, which is the ceiling of your abdominal cavity, and then you've got your pelvic floor, which is the bottom or the floor of your abdominal cavity, and everything in between here are your core muscles. You've got muscles coming down the front and also around the side into the waist. So I'm going to teach you how to engage these deeply, and this is something that you kind of need to practice. We'll do a seated version. Richard will do that sitting in a chair. I'm going to do my version laying down. You can also do these standing as well. I do find that when you do them laying down, you get a better sense of those muscles engaging. You can do them laying on your bed. If you do have a very soft bed, you may not get that feeling quite so much. So let's make a start. So I'm going to come into a laying position. So we're going to have our feet and knees hip width apart, same as when you're seated as well. And make sure your pelvis, if you're laying, is neutral, so my hip bones are facing the ceiling. And if you're sitting, make sure you're sitting up on your sit bones. So you're not slouching into the chair, you're lifting up into your sit bones with a nice tall spine. If you do have lower back problems, then maybe pop a cushion behind your lower back. Okay, so let's have a think about this. So belly button first. We're going to start with the middle of the abdominal cavity, the belly button area. Gently draw the belly button back towards your spine. Make sure you still breathe, don't hold your breath. These are lower tummy muscles here, down in the lower abdomen. Think about scooping them in and up. So you want that to go a little bit firmer here. And then if you can, this is a bit more tricky, but if you can, around the ribs here, gently draw those muscles down. So these 2 points are coming towards one another. Keep the buttocks relaxed. Hold that engagement in the core and breathe in through the nose and out. And again, in and out. And then relax everything away for me. Okay, let's try that one more time. So belly button to spine. Lower tummy, draw it in and up. Ribs in and down. And you should be relatively firm here in the lower abdomen. And also if you feel in the waist, Richard is the same if he's sitting. Have a little feel, make sure those core muscles are engaged. Breathing in and out. And again, in and out. And relax that off. Good, well done. Now also, when you're doing these abdominal exercises, you can do these when you are doing things around the house, because when you engage your abdominals, you also protect your back. So think about when you exert yourself, so lifting the shopping out of the car, mowing the lawn, doing the hoovering. Think about trying to engage those core muscles whilst you're doing things around the home as well as doing them independently. And that will also help to strengthen those muscles but also protect your lower back as well. Okay, so now the pelvic floor. So, first of all, we need to make sure we understand how to engage the pelvic floor muscles before we actually do the exercise. So if you think about you're having a wee and mid-flow you want to stop yourself from having a wee. Now don't actually do this whilst you're on the toilet, okay, because it can cause urine infections if you do it. But think about you having a wee and imagine you're stopping yourself from having a wee mid-flow, and you should feel those lower muscles engaging. Try to keep your buttocks relaxed and then release them away. Also, when you do this, you may find that you feel like you want to hold your breath when you do that. So just try to keep breathing. So with me, imagine as you're having a wee, draw those muscles in, stop yourself from having a wee, breathe, and then slowly relax them down. Now one of the exercises, which is a Kegel exercise, is exactly that, but you're drawing up for a count of 4, and then slowly relax for a count of 4. So imagine you're having a wee and you're stopping yourself from having a wee. You're drawing those muscles in and up. 1, 2, 3, 4. Breathe for me. and then relax them down. 1, 2, 3, 4, and then relax completely. Now you'll find that going down is much harder than going up. It's much harder to control. So if you kind of get to 2 and you think, well, it's gone, that's quite normal. You just need to practice it to get the control of those muscles. And obviously this will have a big impact on your continence, on your function of the pelvic floor muscles, and your back stability and your hip stability. So it's really worthwhile actually isolating those muscles. So once you've got a grip of those muscles and you know what you're doing, we can actually create another exercise with those, which we're going to do now. So again, you can do this seated in a chair, which Rich is going to do, but I'm going to do them laying down on the floor. So my feet and knees are hip width apart. If you're seated, you're in your sit bones. If you're laying, your pelvis is in neutral. I'm going to think about engaging my pelvic floor muscles. So I'm going to stop myself from having a wee and hold to a point that you can maintain that hold. So don't go too hard with it. Make sure you're breathing, and then I want you to lift your right foot just off the floor and try and hold on to that pelvic floor. And then relax the foot down, and then relax the pelvic floor. Now you might find that when you put the foot down, the pelvic floor is disengaging as you do that. And again, that's just a control thing. So it just needs a bit of practice. Let's try that again. Keep the buttocks relaxed. Draw the pelvic floor up, so stop yourself from having a wee and hold and breathe. Left foot, pick it just off the floor. Hold that pelvic floor. Good. Lower the foot down. Now release the pelvic floor. It's quite tricky, isn't it? Let's do one more on each leg, okay? So engage the pelvic floor. Stop yourself from having a wee. Keep your buttocks relaxed. Breathe. Float your right foot just off the floor. Hold the pelvic floor. Keep the pelvis in neutral. Place the foot down. And then relax. And last one for me. So stop yourself from having a wee. Buttocks are relaxed. Left foot. Pick it just off the floor. Try and hold on to that pelvic floor and breathe. And relax it down. Good, and rest. So try those abdominal contractions around the house on a daily basis. And those pelvic floor exercises, I would suggest you do maybe 5 or 6 exercises of those, every day if you can. And that will really help with your recovery from treatment, especially surgery, going forwards. So I hope that's useful for you. I really hope that you've enjoyed the circuit. We've really enjoyed making this video for you. Best of luck with your treatment and with your recovery.
Yeah, good luck everyone, well done. Thanks very much.